Dr. Jane Boland from the Texas A&M School of Public Health here to talk about this. Dr. Boland, we're talking about doctors, dentists, pharmacists, basically disappearing from rural communities. Tell us more about this.
Well, what we learned from our national survey is that there are significant challenges in providing adequate numbers of healthcare providers. Texas A&M, being a land-grant university, is specifically committed to educating physicians, nurses, dentists, pharmacists, public health officials, and our survey showed that there are still significant challenges.
I want to pop up some numbers on the screen here because these were alarming when I read this, and I think our viewers will find this interesting. For anyone living more than 30 minutes away from the nearest hospital, their mortality rate's at 46%. This was even more alarming, I thought. Only 9% of doctors are practicing in rural communities?
Correct. Even though 20% of the population lives in rural areas, only 9% of doctors practice there. There are slightly more nurses, but they don't rise to the level of 20%, and very few dentists and pharmacists. So there are significant shortages of healthcare providers in rural areas.
And we weren't just talking about hospitals, doctors, talking about dentists, pharmacists, paramedics, EMTs. How did we get to this point?
Well, I think because healthcare providers, large health systems, insurance companies tend to practice or have their corporations in large urban areas, that it's harder for them to provide the services out in rural areas. However, healthcare services are it's a big significant need in rural areas.
You know, when we talk about rural areas and the type of work that's out there, you've got agriculture, forestry, fishing, oil field workers.
Right.
You've got that kind of work, and then the lack of healthcare providers out there. We're talking about a big problem.
Correct. Traumatic injuries through oil field trauma, motor vehicle accidents, agricultural accidents, those are huge. And yet we don't always have the emergency medical services, not always. There are far fewer emergency medical services in rural areas.
We've got about a minute left. What else in your report about this, about the healthcare crisis in rural communities, surprised you, that alarmed you?
Well, chronic diseases for one. Several individuals, especially along the Texas border, Texas-Mexico border, have chronic diseases such as diabetes. Yet they don't have the services they need to properly manage chronic diseases, congestive heart failure, COPD, diabetes. And so it is a significant problem providing these kinds of services to rural populations.
Any fix, solution?
Well, I guess we'll wait and see how the Affordable Care Act deals with it, but I think states can adjust and target those areas for increased health care service.
You've got the report here in your hands. It is called the Rural Healthy People 2020. We will link this on our website so our viewers can download the entire report, look at it. This is fascinating, and I appreciate you coming on and talking more about this. And a very important topic for really everybody.
And thank you.
All right,
we appreciate it.
Thank you so much. Dr. Jane Boland with the Texas A&M School of Public Health.